Hi, I am Dr. Rajanya. So this is how we do single chamber permanent pacemaker. So this case presented to us with complete heart block, and due to economical reasons we decided to go with the single chamber permanent pacemaker. So in this video which I have recorded live in the OT, I have mentioned every steps of the pacemaker implantation. So first step, you can see we have to puncture the skin around the lateral and middle 1/3 of the clavicle around 45 angle, and once you insert your needle and then you check if blood is coming back or not, and once you see the dark blood is coming, you are sure that you are in, and then you can go with the wire, 3/8 wire, which you can see entering the heart from the subclavian vein to RA. You can also see the temporary pacemaker is also in situ. Now you have to dissect the fascia with the blunt scissor. So further steps can be done. Now you have to insert the pacemaker sheath over the wire, and initially you will feel the resistance while you go beneath the skin, and you must observe with the fluoroscope. So you can see there where the sheath is going, and here we can see the sheath is in situ, and we remove the wire now. Now we go with the permanent pacemaker lead. Here is a single lead because a single chamber pacemaker. So from the sheath we are inserting the PPA lead under the fluoroscope, and which can be seen entering. Now we will stop it around the tricuspid valve so that we can insert J-shaped pre-shaped wire inside the PPI lead, so it can take the shape slightly curved at the proximal end, so it can go up to like RV apex or RV septum. Usually I prefer the RV septum so that it is more physiological position. So now you can see I may pull and push the J-tip wire, and will adjust the pacemaker lead accordingly. You can see the RV lead is around the lower RV septum. Now you check the threshold with the pacemaker people. Once you are sure yes it is well in contact with the RV wall, you just have to apply this screwer so that you can move it clockwise and fix the lead by screwing it. Under the fluoroscope you will see the screw will come out gradually at the proximal end, and once you try to pull out, you won't be able to pull because it will be fixed. So this is passive fixation with the screw. Here you can see rhythmic movement of the PPI lead along with the RV wall movement. Now tear the sheath and pull out the sheath so that only PPI lead will be in situ once you remove the PPI sheath. But always remove it under the fluoroscopic guidance so that screwed PPI lead won't move from its original position. Now you have to take the sutures in the subcutaneous fascia over the pectoralis major muscle. Usually there are 3 markers over the PPI lead, and over every marker we apply 3 knots, and 4th knot we apply separately to fix the lead over the pectoralis major muscle. These are the reobservable sutures. Once you have done it, take PPI battery which comes along with the pacemaker, and you can insert sutures from the pacemaker battery. and you have to encircle the leads which is connected to the pacemaker battery, and now insert the pacemaker battery in the pocket. See how it is encircled. Keep the lead below the pacemaker battery so that in the future, after few years, when you change the battery, you won't cut the leads. It must be below pacemaker battery, and you must check under fluoroscope once you are fixing it, because you don't want to entangle it. So that was it. Thanks.